Affirmations is an LGBTQ community center. And so folks come to us for a variety of programs and services, one of them being meeting their mental health needs. We had started a mental health program, a therapy program, a few years back, and we were having a hard time expanding it. Meanwhile, the need kept growing. Our wait list for clients who wanted to see a therapist, this would be individual one-on-one therapy, was growing. And we knew we had to take action. We knew we wanted to expand the program, but we knew that we needed some support in order to do that. And so that's really what caused us to reach out. Once we received the grant, we were able to immediately move our part-time Health and Human Services assistant into a full-time role. This immediately changed capacity for our therapists. So as an example, prior to this, our therapists were doing all of the client intake, which is quite a lengthy process. Having this full-time Health and Human Services assistant allowed us to revamp that process where they are taking on some of the responsibility of client intake. But it also allowed us then to look at our billing processes, our client experience. You know, from the time that they first reach out to identify that they need services to the time that they're matched with one of our therapists. Our new full-time Health and Human Services assistant that was possible because of this grant allowed us to do that. This position also helps folks navigate our care coordination. So these are things like our food pantry, access to transportation funds, food delivery to their homes if they have transportation issues, our legal clinics. It really allowed us to have this hands-on person, this point of contact besides the therapist for our clients that could really offer this kind of wraparound care for them and help them navigate what can be some very difficult, administrative processes. As the executive director for the organization, I get to see firsthand that impact. I have a client story of a client that came to us who was in a violent relationship, a violent marriage. And we were able to connect them with resources to help them not only navigate a divorce, but find temporary housing. They were unemployed. We were able to find them employment. We were able to meet some food insecurity needs that they had for their family. They had small children. And having the capacity to reach our community in that way is something that wouldn't have been possible before we received these funds. So we're incredibly grateful.